Because we're at a critical juncture with coronavirus and we're trending in the wrong direction, I've decided also to have a press conference tomorrow at 1 o'clock because there's a lot of information that I need to share with you and some new restrictions. So this week, 1 o'clock today and again 1 o'clock tomorrow. So please try to make an effort to tune in tomorrow at 1 o'clock. Okay, we have a lot to get through today, so I'll begin as we always do with the data, and I'll ask you please to put that up on the screen, put the dashboard on the screen. I want to spend most of our time today unpacking the data and what we are seeing in Rhode Island as it relates to the coronavirus. And I'll begin by saying it's not great news. It's not great news, and I need everybody to pay attention and focus, because we need to get ourselves back on track. So what I'm about to share and the information before you is meant to be a bit of a wake-up call for all of us to say, okay, I need to become more vigilant. So yesterday we performed 6,000 tests and we saw 160 new cases. That yields a percent positive of 2.7%. That's too high, nearly 3%. That is not where we want to be. In the last week, we've seen several days over 2% for the first time in months. And so we have to watch it closely. In fact, other than in these past couple of days, the last time we had a percent positive of 2.7% was August 3rd. And if you recall, we were in the thick of it then, right after 4th of July. Even sadder than the new cases, yesterday we reported 8 more deaths. These numbers have been slowly ticking up for the past few weeks. And now, and we've been watching it, and each week we've been watching it, but it's becoming clear now that it is a trend, and it's a trend in the wrong direction, and it's time to course correct before it becomes a real problem. Percent positive last week was 1.6%, and I suspect next week it'll be even higher if we're still on the same curve. Just as concerning, perhaps more concerning, we're also seeing a big jump in new hospitalizations. New hospitalizations last week, we saw a big jump up to 106 compared to the previous week of 67. So in the space of a week, we went from 67 new hospitalizations to 106 new hospitalizations. And you'll note on the screen before you, new hospitalizations arrow is in yellow because we're trying to highlight for you, a warning sign that over the past 4 weeks, we've seen a doubling of our hospitalizations. That's a wake-up call. A doubling of our hospitalizations in the past 4 weeks. And I've been hearing from the folks that run our hospitals, Gov, we're getting concerned. So listen, we are still below, well below our hospital capacity, well below our hospital ICU and ventilator capacity. So I don't want you to panic, because we have great doctors, great nurses, and plenty of hospital beds. But I do want you to be concerned and alarmed and jolted into making some changes, because we're on the wrong path. We need to change the path we're on. Instead of being like this, we want to plateau. We know once our numbers start to tick up, we've been through this before, once the numbers start to tick up, it doesn't take long before the increase becomes exponential, and then we get into trouble. By the way, you're seeing it in Wisconsin, and I'm going to talk about that in a minute. So, as I've said before, we've been testing a lot recently, and that's why you also see on that we've gone above the 100 cases per 100,000. I was asked about that last week. If it were only 100 cases per 100,000, I wouldn't be as concerned. But the test positive is up, going up, and at an uncomfortable level. The hospitalizations are going up way too fast, and sadly, our fatalities are not where they need to be, and we're over 100 cases per 100,000. So no matter how you slice it, we have to adjust. So you probably have a few questions, which is, why is this happening, Governor? Why is this happening? What does it mean? And what are we going to do about it? So give me a minute, and I'm going to go through answers to those questions. Why do we think we're seeing it? What does it mean for us? And what are we going to do about it? The bottom line is this. Let this be a wake-up call to us, Rhode Island. It's time to make some changes. We've all, including me and my family, become a little too relaxed, and it's time to jolt ourselves back into more discipline around mask wearing, staying home if we're sick, and social congregations. Okay, so we spent an enormous amount of time poring through the data to figure out why is this happening. So I'm going to do my best to explain to you why we think it's happening. And I'd ask you please to put the slide up about case trends. The first thing I'll say is this isn't an outbreak like we saw in the spring. In the spring, and even in the summer, actually, outbreaks were being driven by large gatherings, eating out, big parties, etc. That's not happening now. It's actually small social gatherings that are causing our problems. On your screen is a slide showing all positive cases in the state of Rhode Island since September 8th. The top line in black is all of our cases. And you can see that's not a good picture. It's a steep slope up. It's really interesting to look at the bottom three lines that are flat. There's a red line, a green line, kind of a purplish magenta line. Those lines at the bottom that are flat look at our cases among colleges and universities, K through 12 public schools, students and staff, and our nursing homes and congregate care. Those lines are flat, actually in some places declining. So we know this isn't schools, not K through 12 schools, seeing no evidence of spread or outbreak, not congregate care, because we are testing like crazy there and managing it, not restaurants, because they're doing a terrific job, and for the most part, not businesses. In the middle, you see the blue line, which shows all other cases minus schools, colleges, and nursing homes. And that's where all the action is, in that blue line. The blue line has the steepest slope. It's where we have our problem. And we've done an enormous amount of looking at all the data in our contact tracing. Here's the bottom line. We've learned to live with this virus safely in controlled settings. You go to a restaurant, by and large, they're following the rules. You see people have their masks on. It's a controlled setting. You go into a school, the kids are sitting, wearing their masks, washing their hands. It's a controlled setting, by and large. The overwhelming number of cases on that blue line and the overwhelming number of cases spiking up on that blue line is small family and friend gatherings. People who are complying with the limits. Maybe they're only with 15 people, but they're not wearing masks, they're not socially distancing, and their guard is down. By the way, this is what's being seen all over the country. So last week, Dr. Birx came to Rhode Island, and Dr. Alexander Scott and I had an opportunity to sit with her for more than an hour to understand what's happening in America. She came here because she's looking at colleges and universities. She also came here to raise a bit of an alarm bell for New England, because she said she sees in our data exactly what they saw, or similar patterns to what they saw in the Midwest and in the South. It's small social gatherings with people who you know, and therefore you feel safe, and therefore you let your guard down. By the way, I'm guilty of this too. We all are. Think about it. I see it in my family and I see it in my children. It might be your friend group, your extended family, people in your neighborhood, people who you feel that they're safe because you know them. So you have them over for a dinner party. Maybe there's only 10 people, but nobody's wearing their mask. You're sharing food. You're not social distancing. You're not keeping the windows open. You're not outside. A gathering after church, a gathering after a funeral. This is where all these cases are coming from, and they're going to cause a serious spike if we don't get serious now and change the way we handle ourselves. In your workplace, you have to keep your mask on. You know, with your extended family. And I know this is a pain. I'm probably going to hear about it from my brother and sister tonight. It's a pain when you just get your family together. You got to wear your mask. Because these small, social, impromptu, casual events, hanging out at the break room in the office, a small barbecue among your neighbors, these are all the things where we're close together, sharing food, sharing drinks, not wearing our mask. It is the problem. Again, I don't want to be Wisconsin. Hang in there with me for 30 seconds. Let's look at Wisconsin, because they were in a great place, and they're in a terrible place right now. So please put the Wisconsin slide up. The point of this slide is when things get off the rails, they can go very badly quickly. Wisconsin was seeing similar to what we were seeing, small, consistent upticks in percent positive. Small, consistent upticks in percent positive. Nothing to worry about until it was. We've been in contact with them, and Dr. Burke shared some of their information. Same problem. Small social gatherings with no mask wearing, no social distancing. It started to add up. Wisconsin saw a 250% increase in hospitalizations in 3 weeks. And in the past 4 weeks, their cases and percent positive have more than doubled. In particular, I want you to, on that slide, look at the location of the blue star on the screen in front of you. That star marks September 10th. That's when Wisconsin had a weekly case rate of 120 cases per 100,000. By the way, that's exactly where Rhode Island is right now. Look at how quickly Wisconsin climbed up the curve right after that. Today, just a month later, Wisconsin has a weekly case rate of 290 cases per 100,000, and today they're opening a field hospital because their hospitals are out of capacity. That happened in a few weeks. So the bad news is, I don't have good news. The bad news is the data that I present to you today is not where we want to be, and we need to make some changes. The good news is we're catching it in time, and it's in our power to put a lid on it so that we don't become like Wisconsin or some of these states in the upper Midwest. We have plenty of time to fix this if we act right now. I have been thinking a lot about this. I have tried to be measured in my response. I don't want to cause alarm unnecessarily. That's why the past few weeks I've been monitoring this, but not ringing an alarm bell. And I've just decided that it's necessary now, which is why I'll be back here tomorrow. We're going to do Facebook Live on Friday. I'm going to be out and about a lot next week. We're going to have some new regulations tomorrow. There is no reason Rhode Island should get into trouble. There is no reason we should have our hospitals filling up. There is no reason we should fly up that curve as they did in Wisconsin. Right now, we can stop it now before it's a problem. But I need to get your attention, and I need all of us to try a little harder and get a little more serious. What we went through together in March and April and May was pretty horrible. We never want to go back there. We don't have to go back there, and we shouldn't go back there. So let's pull together now and do what it takes to control our small informal gatherings with family, friends, church, coworkers, wear our masks always, recommit ourselves to following the rules so we can go ahead and plateau and bend that curve. So I have one specific ask today of every Rhode Islander. Anytime you're out of your house and you're with people, wear your mask and keep your distance. I don't care if you're at your best friend's house. I don't care if you're at your brother's house who lives in the next town just with his family. I don't care if you go invite 2 people from church over to sit with you at your house for a cup of coffee after church. Even if you're with your family, your closest friends, if they're people who you don't live with, I need you to please put your mask on. And keep your distance and stay outside. That's particularly true for our older friends and relatives and people who have underlying health conditions. I need you to, if you are one of those folks who's breaking the rules and having bigger parties than you should, you need to stop right now. If you have planned a Halloween party, cancel it right now. Right now. If you have a Halloween party scheduled, cancel it. And I'll have more to say about the consequences of not canceling it tomorrow. If you're making your plans for Thanksgiving, think about not traveling. This is tough stuff, I know that. We always go to Michigan to see my husband's family for Thanksgiving. We're not going this year. We're at a critical time, and we have to protect ourselves and our state and our economy and our loved ones. So if you're hearing me now, please make a new commitment to wearing your mask and keeping your distance all the time, even with people you know and who feel comfortable to you. And please ask your loved ones to do the same. I think we can turn the trend around. I know we can turn the trend around. Rhode Island's amazing. Look at how well you've done so far. But we have to do it. We just have to get to the business of doing it. We've let our guard down, all of us, and we just have to put our guard back up. So tomorrow at 1 o'clock, I'll be back here to announce some new steps that we're going to be taking to reduce the spread of the virus before things get out of control. Not out of control now. I want to keep it that way. I'm sure you're going to ask, or my friends in the press are going to ask, exactly what are those restrictions going to be? And that's, I will tell you tomorrow at 1. We're still working on it. Let me tell you what they're not going to be. I'm not going to announce we're moving back a phase to phase 2. I'm not going to announce broad changes to clamp down on restaurants and retail and commerce. For 2 reasons. 1, there's no evidence to suggest that that's where the problem is. And 2, people need to keep working. Our economic crisis is as brutal as our public health crisis. I'm not going to be announcing changes to schools, closing schools, more virtual learning. Again, there's no evidence to suggest we have a problem with K through 12. If anything, keeping kids in school is helping us because it's a structured environment. So not going to be big changes to schools. That's not where the problem is. In fact, the test positive rate for kids in virtual learning is quite a bit higher than kids in person. So, and we know there are huge downsides to kids. So not going to see to being out of school. So we're not going to see that. We're trying to think creatively about having targeted, data-driven, effective approaches to clamping down on small social gatherings, gatherings at work, in ways that keep us safe but don't hurt our economy. And that's what I'll say today. For the details, come back tomorrow at 1. We are going to start enforcing, with a little more strength, the regulations that we put forth tomorrow. Again, because it's important that this is a wake-up call. It's a wake-up call for all of us. And I'm worried about the holidays. I'm worried about Halloween. I'm worried about Thanksgiving. The truth of it is, we've been at this for a long time. We're all sick of it. I get that, but we're not through it yet. So we have to buckle down. Okay, I want to say a word about testing, because testing is going to play a very big role in this next phase. And again, this was something that Dr. Birx impressed upon us last week. We need to really increase the amount of testing we do to asymptomatic Rhode Islanders. And I'm going to have a much more detail to announce about that, either later this week or early next week. We need to start doing more mandatory testing of asymptomatic individuals so we have a better feel for, where the virus is. It turns out we've gotten very good at isolating when we test positive. And I want to thank you for that, because that's really hard, especially if you're not very sick. By and large, people, when they're told they're positive, they isolate. Their contacts quarantine. So that's good. We have our systems in place. The bad news is there's a lot of people out there who don't have symptoms, who are positive, who are out and about, and who are spreading. So that's on us. What we are going to do is come back to you with greater systems for asymptomatic testing. What I will, and I'm going to begin myself to start getting tested on a weekly basis. And I would ask you to think about increasing your own testing if you're asymptomatic. So I want to remind you, you could go to portal.ri.gov, and sign up for a free test even if you don't have symptoms. So if you're a teacher, if you work at a restaurant, if you work at a manufacturing plant, if you're a member of the clergy, if you went to a party, if you went to a house party or a church party or some kind of gathering last weekend and you were with 10 people and nobody had their mask on and you were sharing food, go get tested, please. It's free. Portal.ri.gov. If you just think you've been around too many people not wearing masks, please go get tested, even if you feel fine. So that's my message for you today, portal.ri.gov. And next week I'll have more to say around new ways of testing across the population. Okay, I'd like to make an announcement about Providence and Central Falls schools. I'm going to change gears for a minute. At the end of August, we announced we were moving forward with in-person learning, and we set this week as a target date for when we wanted all schools to be phased into their full reopening. I'm pleased to say, by and large, really by and large, districts have done everything they can to get as many kids in school as often as possible. So thank you, thank you, thank you. Teachers, principals, superintendents, way to go. Been a lot of work, but I think you should be very proud of yourselves. I also want to say thank you to the National Guard and the folks operating our Education Operations Center. The EDOC has been absolutely critical to advancing this mission. At that time, there were two exceptions, Central Falls and Providence. Everyone else was cleared for full in-person learning. We held back for Central Falls and Providence. They're high-density communities with a high case incident rate. We asked them to start with partial reopening. By the way, partial reopening in both districts meant in-person learning would be available to all elementary school students, and that has been happening. That's exactly what we want to see. Our youngest learners, kids with learning differences, English language learners really struggle when they're not in person in school, so we want them to be in school, and that is happening. At that time, we also said that after a month of school, RIDO and RIDE would examine a variety of factors and make a decision for the rest of the semester. And our team, led by Dr. Alexander Scott, spent the last week examining the data. And as a result, we're going to keep Central Falls and Providence in their partial reopening scenario for the rest of the semester. So I hope that gives some clarity to everybody around what's going to happen in those two towns. I want to be very clear about this, what it means and what it doesn't mean. It means we're concerned with the trends we're seeing in the community in Providence and Central Falls. By the way, just as like we are in every community. It does not mean that they've been having spread or a high preponderance of cases in schools in Providence and Central Falls. In fact, they haven't been, and in fact, by and large, the systems are working very well. So in the last month, since we've been open, they've only had 47 cases among in-person learners in Providence and 45 cases among virtual learners in Providence. Only 10 schools have had more than one in-person case. So the safety precautions in Providence are really working. There have been cases, nothing more than we can handle, and no big outbreaks. By the way, I want to say thank you to all the teachers who are working under really difficult circumstances. You're doing a terrific job, and I appreciate it. And to everybody, the custodians are working harder, superintendents working harder. It's a really anxious time, and on behalf of the children, I want to say thank you. In Central Falls, we've only seen 7 cases associated with in-person learning and 9 cases associated with virtual learning. So again, the approach is working in Providence and Central Falls. So we're going to stick with where they are. I would like to take this opportunity, however, to highlight that Pawtucket, although I have a big thank you for everyone who's working hard and doing the right thing, I have a huge disappointment for the school committee in Pawtucket. Why is it that you are robbing the children of Pawtucket an opportunity to learn in school? These kids deserve it. Why is it that they can go, elementary school students are going to school in Providence and not in Pawtucket? They're going to school actually everywhere else in elementary school, but not in Pawtucket. So I'm devastated for those kids, and I'm devastated for their parents, and I think it's not fair. So I'm asking the mayor, I'm asking the school committee to step up and lead. I'm asking the superintendent to try a little harder, to be a little more creative, and do what you can to get as many children in school as is safely possible. I know it's not easy. You might be worried about politics. You might be worried about finances. Every other district has figured it out, and I'm asking you to try a little harder because the kids deserve it. And we're here to help you if you want a hand. 2 other quick announcements. One, my Commerce Department announced this morning expanded commerce relief, expanded the Restore grants, larger grants for small businesses, also an expansion of the program to nonprofits, which we're doing in partnership with the Rhode Island Foundation. So I want to thank Commerce Secretary Pryor and the Rhode Island Foundation. Press release went out this morning. All the details are on the Commerce website. I know businesses are really struggling. The Take It Outside initiative has been a big success, so we're going to continue with that. And again, we're launching more broad relief for businesses. Starting today, we announced it, so please check that out. And then the second thing, the United States Supreme Court ruled that the census will stop tomorrow. I think that's a wrong-headed decision, and it's regrettable. It is, however, what is happening. So if you're out there and you haven't filled out your census, please do it today. Please do it today. Just go online. It takes a couple of minutes. Go online to 2020census.gov, 2020census.gov. Fill out your census today if you haven't, because the deadline is now today. It's not the end of the month. It had been the end of the month. The deadline is today. Fill it out today. Especially now, as we're dealing with this crisis, we need every penny of federal money that we deserve. If we are undercounted, that means less money for schools and for public health and for food and for housing. So please take a second and fill out the census today if you haven't.